So body position plays a major role, okay? Because now I have an obstruction here, right? If I sleep towards this side, both both are going to be obstructed. Both sides are going to be obstructed. So, and when we are in a supine position, thumb fallback is more. So if we sleep to the side, it will be less. So when you do an extensive sleep study, you will get at which position it is more, which position it is less. Simply you can't ask the patient to sleep to the side. You can also advise to which side. Now for me this is blocked, so I sleep to this side so that this remains open. Okay. So there are some other tests called home sleep apnea test. I feel this gives, though this is not as extensive as your regular sleep study, you sleep better at home in the comfort of your bed. Okay. Now we are also, there are newer solutions. It's like a watch with a sensor and all of that. Not the Apple Watch. I'm not talking about that. Even they have some components for OSA, but you have something. This is strapped to your chest. You have something that's in the hand. We may be bringing it to India so that it will help for. Yes, PAT, actigraphy with a pulse oximeter. So ma'am is an expert. So any doubts that you have, you can ask ma'am. So when you sleep better at the comfort of your home, you get a more. It's less likely you'll get a false positive result. Okay. So this is how you get in a home sleep test. What is your AHI? Now, why I'm telling all of this again and again, I'm telling this aspect of the treatment with the appliance is simple, but you should know this medical aspects also. Now, what has been the gold standard for this problem? What have everyone been using is a machine called CPAP. Most of you would have heard CPAP, right? CPAP is nothing but continuous positive airway pressure. Basically, a machine is going to push air and remove that block in your airway. So depending on the severity of the obstruction, the pressure will increase. Okay? So you have different types of CPAP. You have something called BiPAP. So BiPAP, you can set two different pressure, one for inspiration, one for expiration. Then you have APAP, which is auto-titrating PAP. So it's all different types of CPAP only, where the pressures automatically adjust. So depending on that, the cost will increase. Now all of this is good, it's just that people stop using after a while because it's a machine that you have to carry, okay, wherever you go. Once you start, you can't sleep without it. My cousin has 3 machines, he travels a lot. So wherever he goes, once he keeps one at home and then one portable kind of thing for the intermittent travel. There's a portable version which he uses on the flight also. So my uncle who visits me every year has kept one in my house. So, and I asked him, "Sir, can I use?" No, it is linked. There is an app and all of that, so they know how much is using, how it's that advanced, but it's kind of expensive also. And after some time, you get fed up and people stop using, which is why oral appliance therapy is advocated. Or most sleep physicians are going into oral appliance therapy. The person behind this now, this treatment, is a Canadian sleep physician with a team of sleep dentists. So he's got he's been 40 years in sleep. He's got, I think, around